Hey everyone, welcome to another episode of Tech Podcasts, Dev Technosys. I'm your host Yash, and today we're talking about something that affects over 500 million people worldwide, diabetes. Managing diabetes is a lifelong commitment, but with the rise of smart mobile health technologies, things are becoming a lot more manageable. So today's episode is all about how fitness apps are transforming diabetes management, helping patients track their lifestyle, maintain better control of their glucose levels, and improve their quality of life. Joining me is Aditya, a healthcare tech consultant and mobile product strategist at Dev Technosys. He's worked closely on building fitness and health monitoring apps, and he's here to break it all down for us. Welcome, Aditya.
Thanks, Yash. Great to be here. This is a topic that's very close to my heart, not just professionally, but personally too. I've seen friends and family members struggle with diabetes, and it's amazing to see how far tech has come in helping them live better lives.
Absolutely. Let's start with the basics. When we talk about fitness apps helping diabetic patients, what exactly are we referring to?
Good question. We're talking about apps that combine physical activity tracking, nutrition logging, sleep data, glucose monitoring, and medication reminders, all in one place. These aren't just fitness trackers anymore. They've evolved into personalized diabetes management tools, thanks to AI and wearable integrations.
That's a big shift from the old paper logbooks people used to keep.
Exactly. Earlier, you had to manually write down blood sugar levels, remember what you ate, and hope you're doing it right. Now, fitness apps automatically track your steps, heart rate, calories burned, and even suggest low-carb meal plans based on your goals. Some even integrate directly with continuous glucose monitoring, CGM devices, and smart glucometers.
Let's talk about that integration. How do these apps pull in real health data?
Most fitness apps today sync with devices like Apple Watch, Fitbit, Garmin, or smart glucometers. These devices collect your activity, sleep, and sometimes glucose data, and the app creates a complete health profile. If your sugar spikes after lunch, the app might alert you to go for a walk or review your meal intake. At Dev Technosys, when we build these apps, we integrate Bluetooth connectivity and use health APIs like Apple Health Kit and Google Fit, which allow us to pull data in real time.
That's smart. So it's not just about logging, it's about active support.
Exactly. Many apps now use AI algorithms to analyze your habits and give timely suggestions. For example, if you've had poor sleep and high sugar levels for 3 days straight, the app can recommend rest, hydration, or a diet tweak. Some even allow real-time communication with certified diabetes educators or your doctor.
That could be life-saving. What kind of impact are we seeing on patient behavior?
It's massive. Users who regularly engage with these apps are more likely to stick to exercise routines, make healthier food choices, and take medications on time. We're also seeing reduced anxiety because patients feel more in control of their condition. One study showed that people using fitness apps tailored for diabetes management experienced a drop in HbA1c levels by 0.51%, which is clinically significant.
That's impressive. Let's talk features. What are the key features a diabetes-friendly fitness app should have?
Great question. A powerful app should include step and activity tracking, integration with glucose monitors, food logging with carb counting, custom exercise suggestions, medication and insulin reminders, sleep tracking and stress analysis, weekly or monthly health reports, doctor sharing options, or remote monitoring. It's also important that the app is easy to use, especially for older patients who may not be tech-savvy.
Makes sense. Are there any apps out there that are leading the charge in this space?
Yes, apps like My Sugar, Glucose Buddy, Health2Sync, and Fitbit, especially when combined with CGMs like Dexcom or Freestyle Libre, are doing amazing work. But we're also seeing a rise in custom healthcare apps built for clinics or diabetes care centers. These apps allow patients to log vitals, book appointments, join support groups, and receive real-time coaching.
That brings me to my next question. What if a clinic or health startup wants to build their own diabetes management app?
That's where teams like Dev Technosys come in. We offer end-to-end healthcare app development, including patient onboarding and history, device integration, CGM smartwatches, diet and fitness tracking, secure doctor messaging, real-time dashboards for clinicians, HIPAA and GDPR compliance. Our goal is to not just build apps, but to create digital ecosystems that empower both patients and doctors.
That's powerful. Let's shift to challenges. What are some common obstacles in getting patients to use these apps regularly?
The biggest challenge is habit building. Many patients install apps but stop using them after a few weeks. That's why personalization, simple UI, and gamification are key. We use push notifications, daily check-ins, rewards, and motivational messages to keep users engaged. Also, data security is a major concern, so we focus heavily on end-to-end encryption and user data control.
You mentioned gamification. How does that help in diabetes care?
It makes it fun and rewarding. Imagine earning points for walking 10,000 steps or completing a low-carb week. Some apps offer badges, milestones, or even challenges with other users. This creates positive reinforcement, especially for younger users or those newly diagnosed.
And that's such a smart approach. What's your take on the future of diabetes and fitness app integration?
The future is predictive and preventive. We'll see apps using AI and machine learning to predict sugar spikes before they happen. Imagine your app telling you, based on your last 5 meals and current activity, your glucose might go high in the next 30 minutes. Take a walk now. That's where we're heading. We're also working toward integration with smart insulin pens, voice assistants, and even mental health check-ins because diabetes isn't just physical, it affects your emotional well-being too.
Incredible. Before we close, what would be your advice to someone managing diabetes today who hasn't tried using a fitness app yet?
Start simple. Download a free app that tracks your activity and food. Even if you're not using a CGM, logging meals and movement will give you insight into how your body reacts. Once you're comfortable, explore apps with glucose tracking and set small daily goals. And most importantly, stay consistent. Technology is here to help, but you have to show up for yourself too.
Well said. Thank you so much, Aditya. This has been an eye-opener. To our listeners, whether you're a patient, caregiver, or developer, if you're interested in building or using smart diabetes care apps, visit devtechnosys.com. Their team has the experience and tools to bring your digital health vision to life. Thanks again, Aditya.
Thanks, Yash. Always a pleasure. And here's to tech-powered health and happier lives.